4-H horsemanship, and equine dentistry. Your horse's health is a big part of the horsemanship project, and taking care of their teeth should be a part of your routine. But how do you know it's time to have your horse's teeth checked by a vet or an equine dentist? Mid-Rivers Equine Center in Winsfield, Missouri lists several indicators your horse may have issues with their teeth. Making a mess of their feed or turning their head sideways when they eat. Having undigested feed in their manure. Loss of weight. Excess saliva. Bit discomfort, or tilting of their head when you ride, or unable to stay in frame while you're riding, are all possible signs that your horse needs to have their teeth checked. To understand what your vet or equine dentist is looking for, it's important to know a little about the anatomy of horses' teeth and how they chew. Horses' front teeth are called incisors. Incisors are made to tear grass. The back teeth are called molars, and molars are designed to grind the grass up. Horses chew in a side-to-side motion where we chew up and down. Since horses are grazing animals, they were designed to eat all the time, and that tearing and grinding is how the horses naturally keep their teeth in good shape. Over the years, we have changed horses' eating habits, so we have to help them keep their teeth healthy. This is an X-ray of two horses. Notice how the first horse's teeth line up, and the second horse's teeth look like a roller coaster. It's not hard to tell which horse has an easier time eating or perform better under saddle. Recently, I was invited to watch equine dentist Mr. Greg McKee do dental work on 3 horses. After the horse was sedated by a vet, Mr. McKee does an initial exam, checking for ramps, hooks, sharp points, and broken or loose teeth. He will chart what he finds and determine what can be done to improve the well-being of the horse's health. The first horse he looks at is a 23-year-old Arabian mare named Cheyenne. Mr. McKee finds 2 teeth that need to be extracted before he can start floating her teeth. Here is Cheyenne's chart. You can see Mr. McKee is drawing a picture of what he felt in Cheyenne's mouth, and he marks the teeth that need to be pulled. Then he writes his plan of action on the chart, so when she gets her teeth done next year, he remembers what was done in previous exams. Here is Mr. McKee working on Cheyenne's second tooth that needed to be pulled. Although the first one came out easily, this one took a little more work. Here are the teeth that had to be pulled. The second horse that got worked on was Taz. Taz is also an Arabian mare, but she's only 18 years old. Taz didn't have any teeth that needed to be pulled, but Mr. McKee had lots of work to do to get her teeth to line up so it was easier for her to eat. Here you can see that Mr. McKee is washing his tools. To clean his tools, he has a brush and a bucket with a powerful disinfectant in it called chlorhexidine. As you can see here, Mr. McKee uses a variety of tools. Some are power tools and some are hand tools. Although power tools can make quick work of a tough job, vets and equine dentists still have to use hand tools to finish the job. Horses don't like this part, but it's safer for their teeth and gums. The last horse of the day was Willow. Willow is a 12-year-old thoroughbred mare who raced on the track till she was 8 years old. Now Willow is in dressage training and will be used as a fox hunting horse. Willow had a severe wave in her molars, which allowed her incisors to grow longer than they should. After Mr. McKee fixed the molars, he had to reduce the length of her incisors. There was a little bleeding, but all of the water and disinfectant made it look worse than it was. As horse owners, it's our job to keep our horses as healthy as possible. A routine dental exam by a vet or equine dentist are important to ensure a long and healthy life for your horse.